Right, the reason so many people they're concerned about even the mention of Ebola being here in North Texas is there is still a lot of confusion over exactly how this virus is actually spread. But first responders, they stress they are taking every precaution, everything they know how to do right now to prevent contamination, keep it from spreading. So joining us in studio this morning, Medstar spokesperson Matt Zavadsky. Matt, thanks for coming in early and talking with us about this. You know, I see things you have here. We have gloves and we have gowns and we have disinfectant wipes. With something like Ebola, with there's so much concern about this, is this really still a legitimate first line of defense to prevent it from spreading?
It absolutely is. And, you know, EMS workers are healthcare providers, and we are trained from the very early stages to use universal precautions, and that means universal on every single patient. So while we're responding to calls, we're putting on gloves. When we get any type of indication that there might be some vomiting or diarrhea, we're putting on gowns, goggles, all the things that you see here, not only to keep our responders safe, but to keep the next patient safe.
Okay, so we saw that concern with this first case, that there was some concern about those initial medics and paramedics showing up. And did they know what they were handling? Was there an extra level of protection that maybe that would go into handling a specific patient like this?
Well, and again, Ebola is the big issue right now, but we deal with the flu, we deal with all sorts of infectious diseases. So in this particular case, the precautions that the EMS workers, the healthcare workers take, protect them and the next patient. So on every call, we do all of the disinfectant, we do all of the protection, and to make sure that the ambulance is kept clean after every call and that the next patient isn't cross-infected.
And even though we were pointing out, I mean, we have masks and we have some of those normal things that we see here, this is not transmitted airborne, like just standing around speaking to someone.
It is not, and in fact, it's very difficult for the transmission to occur. Well, it has to be body fluid contact. So as long as we have intact skin, as long as we don't get any blood or body fluids in our eyes or our mouth, which is where all these protections take place, the crew is going to be very safe and the entire healthcare system is going to be safe.
There is a lot of concern right now. Is it going to be passed to me? Can I catch it just from talking to somebody in the neighborhood? And what is a fair, legitimate level of concern that somebody out in the general public should have?
It is not airborne. That's the biggest concern that we have. So as long as you're not changing body fluids with folks that are infected or get poked with a needle from someone who had a needle inside them, this is going to be a very low transmission issue, which is why it's going to be very easy to contain here in North Texas.
Yeah, and we have the equipment and the facilities necessary to try to keep those things under control. Very different than what they're going to have over in West Africa.
Yeah, our healthcare system is totally different than it is in West Africa. We are well prepared for this outbreak.
Okay, Matt, thanks for coming in and giving us a look and a better idea, putting some of this in context for us. I appreciate it.